This is Chad Mixon, and this is my Out of Comfort Zone Skilled Nursing Facility activity. My introduction is that my name is Chad Mixon, and I'm a physical therapist assistant. Growing up, I always avoided nursing homes due to the stereotypes and the negative stigma associated with it. It was not until I worked as a healthcare provider until I truly opened my eyes and understood how true of a blessing it could be to just get involved with the nursing home. The population within these specific nursing homes that I worked at were the geriatric populations. There was all races, all sex, and most religions. What split everybody apart was the variation of cognition and the functional needs everybody needed for assistance, and it had no bias. It didn't show race. It didn't show specific sex favors. It didn't favor anybody. Which brings me to the last point here: is everybody was specific to their own pathology, their own injury, or their own reason for being in the facility. That required them a specific care just for them personally, and it wasn't a racial or discrepancy or anything like that required them for this service. Thoughts, stereotypes, and biases. When I was younger, my first experience with a nursing home was when my grandmother was a nurse at a local nursing home, and there was a few interactions I had with some of the residents when I was younger, and looking back now, I know the residents couldn't control the outcome of that conversation with a small kid like myself, but then it was pretty terrifying for a child to have somebody not having much control over the conversation, and that was just new to me, so I labeled that as a scary place as a child. A lot of people label the facilities based on one experience, like I did when I was a kid. Maybe the nursing home had a bad smell, or maybe they came across somebody that was having a bad day, and I feel like sometimes maybe it's just a bad day. It's not necessarily something we should label as a bad nursing home, or maybe it's just a bad experience. Not all the nursing homes are the same. And lastly, on this point, a lot of young adults have the inability to communicate and associate with the geriatric population, which hinders them from stepping in and just sitting down and talking. They feel like there's no common interest and there's nothing you can talk about, but truth be told, there is. They're still human. I mean, they still enjoy the same things, and they have a lot of the same views that everyone has. The common interests haven't changed much. Personal growth. When I started working full-time in physical therapy, I worked with a company that had several contracts at different skilled nursing facilities, otherwise known as nursing homes. But what I learned was that not all of them were the same. There were different populations in each one. Maybe one was more of a rehab based, and it didn't necessarily have residents that were there for a long-term care. Maybe they were just needing a few more weeks after surgery, or maybe it was a stroke that had more potential for an increase in functional activity, but they just need a little bit more one-on-one time. And normally in the nursing homes, the rehab setting can be a lot more aggressive than in a hospital or an outpatient physical therapy. My next point, the personal growth with connecting and listening to my patients and their experiences. There's been multiple times when I really just sit down during the physical therapy treatment and just listen to their stories. There are many stories. One story that sticks out in my head was there was a patient of mine in Tifton, Georgia, that he grew up with he had a rough childhood and a rough life in the beginning. He told me that he was going to write a book about it, and he was working on how to get it published and all, but the way it started was when he was young, maybe in middle school, his parents left him, and he moved into a back of a grocery store, and the family it took them a little while to notice that he was living at the grocery store, but they then took him in and let him stay in the back of the store where he had his own little cot and own little bathroom and all. But he made himself get up and made himself go to school, and when he wasn't at school, he was helping at the grocery store. And he did that through middle school and high school. He eventually played high school basketball and he was a star player for the high school team, and was eligible for a full ride scholarship to the university in the state where he was living, which eventually led him to the NBA. And that story always really touched me, because every time I saw him, he'd always sit me down and talk to me about how the youth is lazy, and how a lot of people just don't get up and go out and try to do better and be more. And he just really, I feel like if some of the youth today could go in and just sit down and have a talk with him, they would leave that nursing home ready to conquer the world, and really just open their eyes. The next step here is the witnessing the loneliness from the patients, and that they just benefited from the conversation alone. Like I said with the last point, just sitting down and talking to them. There's a lot of them in there that sometimes don't have family in the area, or don't have family that come visit, and they really benefit from just the conversation. And a lot of them, on the physical therapy standpoint, they didn't mind the physical activity. They really just enjoyed the conversation, and they would do whatever they had to do, whatever exercises or whatever I had to have them do to just socialize and get out of the room and be in the area where they could just cut up and joke around with everybody. And lastly on this, like I said before, not everybody in the nursing home is there for a long-term time frame. So helping those people gain their functional independence back, and for some to return home and be safe around their home and around the community, it meant a lot, because a lot of them would come back up there and visit and really hug everybody's neck, because some would lose hope, and we would have to really just keep them optimistic about getting out of there and working hard. And this isn't a long-term thing. It didn't have to be a long-term thing. They could really push harder and regain the functional ability that they had before. They just couldn't give up. Thoughts, reflections, and feelings. With this experience, I learned not to use a preconceived judgment towards something new. So with that being said, maybe meeting new people because they look a certain way, or judging somebody the way they look, thinking they're going to act a specific way. I've learned that is not the case. You can't look at the building and at a nursing home and just say you know everything that's going on inside. You can't use a preconceived judgment of what you think the idea of something new is going to be until you actually get in there and put the effort in to get to know it and learn something new. Just because it's new doesn't necessarily mean it's a bad thing. Like I said before, I found myself enjoying the friendships that were built with my patients and learning their stories. That really it brings a lot to your profession. It makes you want to wake up in the morning and get to work and really just check on somebody when you're walking down the hallway. Maybe if they're not your patient for the day, but you can still stick your head in and talk to them for a little bit and see how they're feeling that day, or see what's going on. It really I like that part of the job, and it makes you want to interact and go to work and get to know everybody in the building. Lastly, throughout this activity and after my experience in the nursing homes, I would like to encourage others to visit the nursing home, the skilled nursing facility, as well as open their eyes that not all the nursing homes are bad or are smelly. Maybe just tell them that it was a bad experience. Maybe it was just a bad day at that facility. They can't really control some of that, because there are times when those things do happen, but it's not the residents' fault. They can't control that. And at some point, we're all going to get sick, and at some point we all will get old. God willing, that we will all get old. But I always tell everybody, if you think about it, if you had a grandmother or your mother was in the nursing home, would you want somebody in there that really wanted to be there and cared about the person and was really going to help them with everything they had, or would you want somebody working there that's just there for a paycheck? I mean, yeah, it may not be the best smelling place, or it may not be the most glorified position that a lot go after, but it's still required and it's still a necessity, and the residents, they deserve to be treated with respect, and they don't deserve the negative stigma that is attached to all the nursing homes. Outcome and plans. Recently, I would say a year ago, I recently changed jobs, and I'm full-time here in Valdosta, Georgia at an outpatient physical therapy clinic. But I always remain on an as-needed basis, maybe on the weekends, to fill in at the nursing homes. And it surprised me because maybe 2 years ago or 3 years ago, I started working in a nursing home. And some of the residents that are long-term, maybe the 103-year-old residents, they're pretty sharp. There are a lot of them that are sharp-minded, and even when I show up and I haven't filled in at that nursing home in several months, I'll walk in and they'll remember that I had knee surgery 2 years ago, so they'll ask me how my knee's been or how so-and-so's been, and they remember where I'm from originally, and they'll ask me how that area is doing. And that's just crazy to me, that sometimes that we overlook age and how we can think that we have that preconceived judgment that they're not as sharp as they used to be, but that is not the case. In my experience, there are a lot of them that are really sharp, and they remember very well. They remember sometimes better than I do. They'll remember my name, and I can't place the name to the face, and I'll just have to kind of go along with it. Secondly, my communication skills have improved greatly, especially with the older generations. Like others, I didn't really think there would be much to talk about, but the common interests really haven't changed much. The older gentlemen, they still like sports. They'll talk about sports and their experiences, and there were so many stories that just caught my interest and caught my attention that I never really would have thought. But there are some amazing stories out there and amazing things to talk about. You could just sit there all day and talk about random topics. I remember one female patient that I had that she actually lived on a boat, her and her husband, and they just cruised for years and years and years until he passed away, and then she got sick after that. So she lived on a sailboat for most of her life until she started living at the nursing home. And I always ask her stuff, and you could see her light up whenever she got the chance to talk about all that. That was just a really good opportunity. And lastly, the outcome really raised the occupational and life skills that in this experience. I gained a lot from this experience, not necessarily just for my job, which there are specific things that you learn in the nursing home and ways to go about specific procedures and how to go about your specific therapeutic treatment to reach all the goals, and how you can use a little bit of psychology to get what you need done, and how you can word things, and how you can just really communicate with people and read them and really get them interested in what you're trying to help them with, as well as the life skills like the communication and just really getting in there and getting to know people and learning the lessons of no preconceived judgment of others, and really just talking to people and seeing the best in all. Lastly, I say join the party and get involved. This is just a picture of a random nursing home activity. And you see this mostly everywhere. I know a lot of nursing homes have the beauty shops, which I would lose a lot of my patients for the ladies, because they would want to go get their hair done for that day, and I'd have to chase them down, try to catch up with them before they got to the beauty shop or after the beauty shop. But they all enjoyed this. This looks like a little dance that they were having to socialize and just have fun. So I say get involved and get in, and no matter what you have to do, you can get in and just maybe do an event like this or some type of activity for an hour maybe get your church involved, something like that.